Hello, everybody, with talk number 4 in the series of talks about innovation in surgery. You remember we promised you to take you on a journey about the innovation in surgery, from the history of innovation to the roadmap to innovation of new surgical techniques. So through these 12 insightful talks, we will talk you through this journey. And now we come to the fourth station in our talks, the multidisciplinary approach in surgical research and how this multidisciplinary approach can help us in innovation. Are you ready? Fasten your seatbelts and ignite your curiosity, and let us start the journey. Traditional approach in surgical research depends on cohort of patients undergoing surgical procedure, and this cohort will be then taken to be analyzed for the post-operative outcomes. Traditionally, we take the complications as the most important post-operative outcome measurements, and then using some statistical analysis, we can come to a conclusion about what factors affecting the post-operative outcomes. However, this approach is full with biases. Unfortunately, there are selection bias, sometimes publication bias, and the most important is the confounding bias. Because as we explained in talk number 3, there are hundreds of factors affecting the surgical outcome. So signaling some few factors without adjusting for the other factors will make the conclusions unjustified. Another thing is that how much innovation we expect from such a traditional approach. So we are proposing another approach to surgical research and innovation, which is the multidisciplinary approach. When we talk about multidisciplinary approach, we think about professionals from various disciplines with diverse skill sets and knowledge bases. They work together towards a common goal. Each member contributes their unique expertise and perspectives, and thus they can address complex medical challenges. And one of those complex medical challenges is the surgical research, because as we explained in the last talk about the modeling of surgical intervention, surgery is a complex intervention. It is not like 20 milligram tablets where you give it this arm and you give placebo on the other arm, and then you can randomize and measure the effect. Surgery is much more complex, and that's why we need another approach to surgical research and development. You may ask, but why we need the multidisciplinary approach? Well, the multidisciplinary approach will give us a holistic solutions. Instead of focusing on the symptoms, we will focus on the patient as a whole. The patient's biology, symptoms, psychology, social context, economic context. This will enable us to make patient-tailored treatment, and thus will lead to improved patients' outcomes. Okay, this is a statement that I'm making. Is there any evidence supporting this, or is it just that I'm saying this? Actually, there are many papers supporting this. One of those papers published in Nature Communications, showing that diversity in scientific collaborations were very important and was related to the impact of the scientific research. The paper concluded that ethnic diversity, for example, had the strongest correlation with the scientific impact of the papers. Interesting, isn't it? Another book collected the evidence to support the diversity. And this book, the author argued that people from different backgrounds approach problems from different angles. And the author is calling for what he calls a cognitive diversity. In other words, assembling a team of people with different perspectives and intellectual backgrounds. This will improve the innovation and make great difference in productivity if we are talking about industrial process. However, this is not without challenges. There are many challenges in the way. Organization and logistic obstacles are many. The cost of having the MDT, because we are taking professionals from different aspects of professions, and the time and resources constraints might be challenging. Then those professionals will have varying professional languages and terminologies. How can we improve and optimize the communication? There will be conflicts. So conflicts are unavoidable, but how can we resolve those conflicts? So conflict resolution and integration and synthesis of knowledge is another obstacle or another challenge, let us call it. And then these challenges will affect the leadership and decision making. So they will dynamically affect the leadership and decision making and be affected by leadership and decision making. There are other minor challenges such as goal alignment. Those professionals, they might have different goals. Interdisciplinary respect and valuation, and then recognition and resource distribution. These are challenges, but they are not unsurmountable. That's to say, they can be tackled. How? Well, to tackle challenges in a multidisciplinary approach, we need first to identify the leadership structure. Who is doing what? Then we need to identify the collaborative tools. This will be the subtopic of our next talk about innovation in surgery. When we have identified the leadership structure and the collaborative tools, then we can start building a team. And when we say team building, it is not one step. It is an iteration. It is a long process. The team need time to be integrated, to communicate best, to understand each other's. So this is a process which will continue throughout the work. It is not just one step. How can we measure the effect of multidisciplinary team approach? So we are proposing this approach, and we should also propose some kind of measurements so that we can prove that we are doing better than the traditional approach, for example. So one way is to use the performance metrics, what we are heading to and how long are we from the goal. Another way is to use the feedback mechanism. The team will together work and try to understand what has been done, what was good, what was less good, and how to improve it. And the third and most detailed one is the outcome assessment. So identifying some outcomes and then identifying how to assess these outcomes and then assess them. This will give the team an idea about where they are heading to and how much success is there or even failure. So you remember from the first talk about the history of innovation surgery, we talked about medical imaging and organ transplant. The advances in physics enabled the invention of X-ray, which has helped a lot in identifying different medical conditions. And then the advances in immunology helped surgeons to make their first organ transplant. So although those people did not work in the same team, but they had some knowledge about what is going around them in other specialties or other professional circles. And this is important. Another recent multidisciplinary team approach to a problem is problem of paralysis, because we have many patients who are paralyzed after, for example, after trauma. In this approach, a team, for example, this is just an example, a team of scientists, they were neuroscientists, orthopedic surgeons, and electric engineers. The scientist fitted a patient with a device that stimulated nerves in his back that once controlled the muscles in lower back and legs, but which lay dormant since his accident, which had a kind of accident. What happened later on that the patient could walk and swim and cycle again. This is really a big step, a great innovation breakthrough, and it comes from teamwork from different scientists with different professional backgrounds. And it's a recent example, as you can see, it's from 2022. To build multidisciplinary team, we need to identify the objectives and the goals. This is, I think, the most important step and the first step. When we identify the objectives and the goals, Then we will make the plan. And this is the foundations of the multidisciplinary team work. If we make the plan, we will reach the objectives and the goals, because the other things, this journey will be the details of how to reach from the foundations to the objectives and goals. One of the things that we need to take care of is the team size. The team should not be a big team, which is redundant, and not a small team, which is inefficient. The team need to be diverse. And again, when we think about diversity, it's not different colors or different genders. It is cognitive diversity, what we are talking about, intellectual diversity. People with different intellectual backgrounds, with different specialties that can contribute to the innovation. And then we need some standard operating procedures so that everybody knows what they are doing and where they are heading to. If we have all these things in place, then we have a good multidisciplinary team with a high chance that they will get through the process and end in innovative, need-driven solutions. We are trying this in open source research collaboration. The foundation of research, we made a research about the anastomotic leak as a problem in colorectal surgery. We identified through our research factors that are very important for anastomotic leak: blood supply, anastomotic technique, microbiota, and patients-related factors. We focused on the blood supply because we think this is the thing that is least studied, and the thing that where we can make an advancement, because of the healing process of anastomosis can affect the anastomosis leak. So throughout CT scans of patients, colorectal cancers who were operated by colon resections, we identified the blood circulations, and we are trying to make patterns of this blood circulation and see which pattern of blood circulation is associated with anastomotic leak and how can we improve it. So it is not only a project about telling us the risk for anastomotic leak and prediction. It's a project that can tell us how can we improve the treatment, not only for anastomotic leak, but also how can we use this knowledge about the small blood vessel circulation and collateral circulations in future projects. And this is a team composed of computer scientists, data scientists, statisticians, surgeons, and gastroenterologists working together under the umbrella of open source research collaboration. Our fundamental thinking in open source research approach to those problems is, first, solid foundations. Solid foundations means doing a research before doing any projects. So we do an extensive research, and this step we might use much time, more time than other organizations used to, or other teams used to. But when we have the research and we identify the gaps in knowledge, then we start building our multidisciplinary team. And then we're thinking about AI, artificial intelligence driven solutions. But this is not an end process, because this process or these solutions need to iterate and fine tuned each time they iterate to reach a solution which is best and most useful for the patients. To advertise for this project under open source research and to advertise for this approach, we had many workshops all over the world explaining the use of artificial intelligence in advancing medical research and especially surgical research. We would be happy to come to you wherever you are and make such a collaboration with you also. So this was about the multidisciplinary team approach to stimulate surgical innovation. I want you to stay tuned to the next talk, which will be about the tools of innovation to be used in surgery. So until this time, stay tuned. And if you want to read more about innovation surgery, visit our website, or even best, join us to be part of innovation in surgery. Thank you.